Welcome to part 2 of sepsis evaluations. This is the urine culture portion. So ideally, you're getting a blood culture and a urine culture and then administering your antibiotics. There are some cases where these babies have tiny little urethras and that catheter ain't going in. So in those circumstances, please huddle with the team and discuss timeliness of antibiotics, hopefully within that first hour after ordering, versus obtaining a blood culture, causing trauma, all that jazz. So today we're gonna be doing a urine culture, and so I'm gonna kind of prep that all for you. So I'm also in a mask again, and I still have my second person, also required 2 people for a urine culture. And we have these lovely handy dandy urine culture kits. If you have a teeny baby, you might need to grab one of those 3.5 French urinary catheters, and then a specimen cup to kind of rest the end in. I'm just gonna pretend like this baby is the jam and is appropriately sized for this 5 French catheter. So I've got my mask on. I'm gonna take this out of here. So all this is sterile in here. So I like to use this as like my sterile field, but some people like to get a whole new sterile field out, which is fine, give it bigger surface area. This blue drape is gonna go under baby's booty. Okay, I've lifted my baby up, tuck that bad boy in. All right, and then I'm gonna unfold this, and then I'm gonna get sterile. So I'm gonna use my hand sanitizer. I let it dry. Get these gloves on. Sorry, technical difficulties. And number 2. Okay, so got your little kit here, got your catheter sheath. This needs to be tightened because it's always too loose. Your sheath can come off, get tossed to the side, and you have to pull out the catheter a little bit. It's too shallow. You then have your cleaning agents. So this comes with your povidone iodine, betadine, and then you're sterile. So you can kind of take those out, handy dandy. And then you can squirt your jelly in here as well. Great. All right, so you're gonna have one hand that's kind of dirty that you're positioning on the patient, and the other hand is gonna guide the equipment and clean and all that stuff. The second person's helpful for keeping your baby calm, and then also sometimes they might need a little set of Q-tips to help expand labia here or there. Sometimes a little 2x2 gauze, they can help push down on a baby's penis to help you better visualize the urethra. Up to you how you want to do that. Some people like to just do it themselves. So we're going to pretend I have a baby here. And you're going to clean with your betadine 3 swabs. 1, 2, 3. And let it dry. Betadine takes a hot minute, so you're going to have to be patient. If someone has a nice light they can shine for you, or use, a bedside light, ideal. And then you're gonna take your catheter and tube, stick it in your little jelly here, and then you can let this kind of dangle as long as the tip doesn't touch. And then aim and insert until you get urine flow. And as soon as you've got urine flowing, just let it flow till, for a urine culture, you need just a couple drops. So for a UA, that doesn't need to be a sterile thing. That is just like a clean catch urine. You can use the Zoroflow or cotton balls in a diaper or a U bag. But for cultures, it always has to be sterile. So that means you're always inserting a new in and out kind of catheter situation. So you just need a little bit for a culture. If you're getting a culture and UA, try to get as much as you can. And then you can remove the catheter, avoiding splashing. Making sure when you're working with body fluids that you've got your go-go on. So you've got your mask, goggles, gloves, and then this catheter just pulls out of here. You close this. This has already been tightened. You're good to go. Print a label, scan it, stick it on there, and then that can go to lab, double bagged in a red specimen bag. And then you're waiting to see if anything grows. Again, hopefully not, but hopefully they've ordered prophylactic antibiotics just in case. So sepsis eval includes blood culture, either aerobic or aerobic and anaerobic, and then oftentimes they'll add on a urine unless the baby's like brand new. So make sure that you're encompassing both things with a culture and not forgetting one, and that you're doing a huddle and that you're keeping your babies comfy, because this is not a pretty process for them sometimes. And then really important is making sure that the family is updated following anything major like this happening. So that doesn't have to be you, but make sure that gets delegated to the medical team. Any questions, please reach out. Thanks.